Dr. Prassh Mehta, let me begin with you and understand what has really happened in this entire unfortunate case. At what point and how can a serious and a grave disease as cancer be misdiagnosed?
So, first of all, my heartfelt condolences to the parents of the child, and really unfortunate if such a thing has happened. So there are a lot of disturbing things which have been said by the parents, which need to be really analyzed and looked into thoroughly. And so I do understand that there may have been a situation where there may have been some ambiguity or gray areas in a diagnosis or in science. In fact, science in itself has gray areas, and these gray areas are there in every science, actually, not even in medical science. And there are medical boards, tumor boards in the case of cancer diagnosis, tumor boards who discuss in detail a diagnosis and then finalize it, and the treatment is finalized. So autoimmune disease can sometimes be a very close mimicker of cancer, and cancer can be a mimicker of autoimmune disease. In fact, many cancers, they actually present itself with autoimmune manifestations. Many blood cancers, they have autoimmune manifestations. They can also have paraneoplastic manifestation, which means that the manifestations can be completely unrelated to the cancer or the location of the cancer. So it's a very complex science. And science is ambiguous because nature has so much complexity, and there is so much of human limitations which exist, even as of now in the modern era. And a diagnosis is established not only on a physical realm, on the clinical symptoms, signs, on the examination, but also now at the pathological, morphological, and immunohistochemical and molecular level. So we have got better with time on diagnostics, and most of the diagnostics are now very concrete and definitive, but still there can be gray areas. But these are generally
But can I
discussed.
understand from you, Dr. Mehta? The mother says
These
that the
these
daughter
cannot be
had lymph node swellings.
these cannot be equated to medical malpractice or
Yeah, that she had lymph node swellings, which can be misdiagnosed initially, but throughout the treatment that she got, could there never be any point where this was realized that this is a misdiagnosis and something as disastrous as this has happened?
So it's very difficult to say based on this very Instagram post, or what the mother has said and stated or claimed. But if you go through the medical records and analyze what has transpired, what has been discussed by the medical treating team, a medical board, and a neutral board maybe. So all these facts can be brought out and can be discussed in detail. What she has written is actually very unclear, and it is not telling us much about what actually has happened with the child. So that is what I can say as of now, based on the very limited information which is there in that post, and what the parents and mother have said.
Hmm.
Yeah. But
Hmm.
you
Hmm.
you, you
Dr.
asked me.
Ishwar Gilada,